Let's continue to introduce descriptive epidemiology to you. This section, we will use cancer as an example to show you how to describe the three dimensions of disease distribution. The first is characteristics of persons. We use this paper as our material. Global Cancer Statistic 2018. For 36 cancers in 185 countries. These pie charts present the distribution of cases and deaths for the 10 most common cancers in 2018 for both female and male. For each sex, the area of the pie chart reflects the proportion of the total number of cases or deaths by sex. Lung cancer is the most commonly diagnosed cancer and the leading cause of cancer death in males, followed by prostate and colorectal cancer, for instance, and liver and stomach cancer for mortality. Among females, breast cancer is the most commonly diagnosed cancer and the leading cause of cancer death, followed by colorectal and lung cancer, for instance, and vice versa for mortality. Cervical cancer ranks fourth for both incidence and mortality. As for lung cancer, we can see from figure that the age standard rate is higher in male than in female in all the countries and areas. This graph shows the 10 leading cancer types for the estimated new cancer cases and deaths by sex in United States in 2019. Prostate cancer was count for 20% of all the new cases in male, while breast cancer was count for 20% of new cases in female. For death, lung cancer is main cause of death for both sexes, 24% for all the deaths for male and 23% for female. Next, let's discuss characteristics of persons by age. This table shows different cancer types by age group in the United States from 2013 to 2015. For all sites, the probability of developing invasive cancer is increased with age for both sexes. Age group at 70 years old with the highest probability 31.9% in male and 26% in female. Next, let's see race and ethnicity. This table showed the incidence rate of selected cancer by race in the United States from 2011 to 2016. Cancer incidence are generally highest among non-Hispanic blacks and lowest among Asian and Pacific Islanders. The overall cancer incidence rate in black men during 2011 through 2015 was 84%, higher than that in Asian and Pacific Islander men, and 9% higher than that in black men. Next, we talk about distribution by place. This figure shows the most commonly diagnosed cancer at national level in males and females. The maps reveal substantial global diversity in leading cancer types. Particular for instance, prostate cancer is the most frequently diagnosed cancer in 105 countries, followed by lung cancer in 37 countries, and liver cancer in 13 countries. In women, breast cancer is the most commonly diagnosed cancers in the 154 countries, and with cervical cancer leading in 28 countries. This bar chart showed region-specific incidence and mortality rates for cancers of the female breast in 2018. Incidence of breast cancer is highest in Australia, America, and Europe, but not for mortality rate, indicated that the medical treatment is better in these developing countries. As for stomach cancer, the incidence rate is highest in Eastern Asia, followed by Eastern Europe and South America for both male and females. This table listed the incidence and mortality rate for 24 world areas all cancers in 2018. Northern America with the highest incidence rate, while China and Southern Africa with the highest mortality rate. Next, let's discuss about time. This figure showed long-term trends in cancer incidence rate for all cancers combined by sex. Cancer incidence patterns reflect changes in behaviors associated with cancer risk and changes in medical practice, such as the use of cancer screening tests. The incidence rate increased from 1975 to 1995 and then stayed steady, then greatly decreased from 2000 to 2016. The rapid incidence increase for males in the late 1980s and early 1990s reflects rapid changes in prostate cancer incidence rates, which spiked in the late 1980s and early 1990s due to a surge in the detection of asymptomatic disease as a result of widespread prostate-specific antigen (PSA) testing among previously unscreened males. In this figure shows the change in incidence rate of selected cancer by sex in the USA from 1975 to 2015. Prostate cancer rate had sharply risen from 19,085 to 90,095, and then decreased from 2005 to 2015 in male. Lung cancer and colorectal cancer has gradually decreased in male, while breast cancer and lung cancer gradually increase in female. Thank you for attention. That's all.